What is the main route of elimination for iron chelating agents? 2 marks. Drugs that chelate iron act by forming a complex with non-transferrin-bound iron and promoting its elimination primarily via the bile, resulting in its excretion in the feces. What is the main indication for the use of polystyrene sulfonate? Mark hyperkalemia. Briefly describe the mechanism of action of polystyrene sulfonate resins. 3 marks. Calcium polystyrene sulfonate, sodium polystyrene sulfonate. They act by exchanging the sodium or calcium ions of the resin for potassium ions and other cations in the GI tract, and the resin is then excreted in the feces, thereby reducing potassium levels. List 4 adverse effects that might be experienced by someone taking sodium polystyrene sulfonate. 2 marks. GI adverse effects. GI irritation, constipation, fecal impaction, diarrhea, nausea, vomiting, anorexia, hypokalemia, hypomagnesemia, hypocalcemia, due to resin's increased excretion of cations. Hypernatremia, exchange of sodium from sodium resin. Hypercalcemia, exchange of calcium from calcium resin. Lethal GI. Obstruction, ulceration, perforation. This question has 4 parts. Name the topical drug class that is used for the treatment of glaucoma that can cause iris hyperpigmentation and eyelash changes. Name 1 drug in that drug class. Briefly explain how that drug class acts to reduce intraocular pressure. How does this compare to the mechanism of action of timolol? 4 marks. Prostaglandin analogs bimetoprost, latanoprost, travoprost. It reduces intraocular pressure by increasing uvoscleral outflow of aqueous humor beta blockers, reduce aqueous humor production, most likely by blocking beta receptor on the ciliary epithelium. Which 2 of the following conditions might botulinum toxin be used to treat? Urinary incontinence, insomnia, obesity, migraine. Bipolar disorder, vertigo. 1 mark. Urinary incontinence. Migraine. For what indication might we use a phosphate binder? 1 mark. Hyperphosphatemia suggests why GI tract upset is likely to be the main adverse effect experienced by patients taking most of the available phosphate binding agents. 1 mark. Common for non-calcium phosphate binders, as it acts by binding to dietary phosphate in the GI tract, forming a poorly absorbed complex. What adverse effects might indicate excessive or inappropriate androgen use? 3 marks. Acne, oily skin, increased BP, increased LDL, decreased HDL, increased PSA, testicular atrophy, male pattern baldness. Where is vasopressin synthesis, and what is it also known as? 2 marks. In the hypothalamus, antidiuretic hormone, ADH, /arginine vasopressin. True or false? Vasopressin is a neurotransmitter and a potent vasodilator. 0.5 marks. False. Neurotransmitter and potent vasoconstrictor. What serious electrolyte imbalance can occur with antidiuretic hormone agonists, and what mechanism is responsible for this? 1 marks. Hyponatremia with water retention. It increases tubular reabsorption of water. Name 1 antidiuretic hormone agonist and 1 antidiuretic hormone antagonist. 2 marks. Antidiuretic hormone agonists. Argipressin, desmopressin, terlipressin. Antidiuretic hormone antagonists. Demeclocycline, tolvaptan. Explain why phentermine can increase blood pressure and heart rate. 2 marks. It relates to its noradrenergic, dopaminergic, serotoninergic effects, overstimulation of the CNS, dry mouth, increased blood pressure and heart rate. Explain the mechanism responsible for the steatorrhea orlistat can cause. 2 marks. It works by inhibiting gastric and pancreatic lipases required for digestion of dietary fat. It reduces absorption of approximately 30% of dietary fat, which then goes on to be excreted in feces. Steatorrhea is proportional to the fat content of the meal. Compare the key differences in action between orlistat and liraglutide in obesity management. 2 marks. Orlistat inhibits gastric and pancreatic lipases required for digestion of dietary fat. It reduces absorption of dietary fat then excreted in feces. A limited role in weight management due to modest and transient weight loss and frequent GI adverse effects. Liraglutide reduces food intake by acting at GLP-1 receptors in appetite and reward relates area of brain to promote satiation and reduce hunger and food reward. Explain the mechanism of action of disulfiram in alcohol dependence treatment. 3 marks. It inhibits aldehyde dehydrogenase, which is a step in alcohol metabolism pathway. It leads to accumulation of acetaldehyde and causes uncomfortable symptoms such as severe facial flushing, headache, nausea, vomiting, palpitations, tachycardia, dizziness. It deters alcohol consumption. New aldehyde dehydrogenase needs to be synthesized before the metabolism of alcohol returns to normal, which can take 1 or more weeks. True or false? Naltrexone is safe for patients with chronic pain taking opioids to take concurrently if they want to cut down on their alcohol consumption. 0. 5 marks. False. Should not be used to treat alcohol dependence in patients taking opioids. At least a week opioid-free to take naltrexone, which one of the following drugs would not be used as a phosphate binder in hyperphosphatemia. Aluminium hydroxide calcium carbonate sevelamer bupropion, 1 marks D. Bupropion is antidepressant and used in nicotine dependence. What indication would you expect varenicline to be used for? 1 mark nicotine dependence match, the topical drug to the condition. It would be indicated to treat. Adapalene psoriasis triamcinolone acne vulgaris fluorouracil solar keratosis. 1 mark adapalene. Acne vulgaris triamcinolone, psoriasis. Eczema fluorouracil. Solar keratosis list 4 skin-related adverse effects that might be experienced by a patient using beta-methasone dipropionate. Marks. 4 all topical corticosteroids. Transient burning, stinging, pain, skin atrophy, increased skin transparency, striae, depigmentation, spider veins, easy bruising folliculitis, steroid rosacea, acneiform, eruptions, perioral dermatitis, delayed wound healing * systemic eye. Adrenal suppression, growth retardation, hyperglycemia, glaucoma. Fill in the blanks. Adapalene is a retinoid that is derived from vitamin A. 1 mark. * treatment of acne vulgaris true or false. Since adapalene is applied topically to the skin, it is safe for women to use in pregnancy due to the minimal systemic absorption that occurs. 0.5 marks. False. Contraindicated in pregnancy due to their teratogenicity. Females should use contraception and avoid planning pregnancy. While on adapalene, treatment described the mechanism of action of adapalene in the treatment of acne vulgaris. 3 marks. Adapalene is retinoids derived from vitamin A. Topical retinoids modulate cell proliferation and differentiation and decrease inflammation. In acne, they specifically decrease formation of new comedones and inflammatory lesions. True or false? During treatment with fluorouracil, it is normal for patients to experience application site reactions that can last for several weeks, and these reactions include swelling, oozing, crusting, and scabbing. 0.5 marks. True. When it's severe symptoms, * common eye, contact dermatitis, photosensitivity, rare eye, hyperpigmentation, and scarring.